So hello from Vienna. We're here at the European Association of Cardiothoracic Surgery meeting, and we have the privilege of speaking for a few minutes with Dr. Rui Almeida. Your list of accomplishments will be too long for us to talk about here, but highlighting full professor, dean of the University Foundation, previous dean of the medical school, former president of the Brazilian Society of Cardiovascular Surgery, current president of the World Society of Cardiovascular and Thoracic Surgery, and president-elect of the Latin American Society of Cardiac Surgery and Endovascular Surgery. Yeah. Did I get those right? Yeah, you did. Well, I mean, how do you have the time is the first question.
Well, basically, my sons went away from home because they're doing residence over, one in vascular surgery, the other one in cardiovascular surgery. So that takes all of the family. And my wife is comprehensive, but it's not too much work. It would be work if you really didn't like it, but I like the associative part. I think it's very important.
So what do you like? What has been the highlight of your presidency this year with the WSCTS?
Basically, you get the most of the work you do to do the meeting, and then afterwards for the next meeting you don't do anything because there's a board over there that works for everything, and you have just to give the chain over to the next president. But the organization of the meeting is the most important thing, and that's finished on the 27th of August.
Yeah, it was a fantastic program in Brazil just a few months ago. And I felt like you had a really great representation from all of the different societies, and globally a nice representation of experts and speakers. So was that more your handiwork putting that all together, or?
Yeah, that was mine. But basically we made a meeting with three societies. The World Society, which is coming up again, LACES, which is very important for us in Latin America, and the South Brazilian Society of Cardiovascular Surgery, which they put the resources so we could do that. It was easy to do because we just invited friends, basically. You were there. So basically it was easy to do because people would come just because of friendship. And we made together with the people that were there, we were very happy with that. We met new people, like that surgeon from Ghana, which is fantastic, and she is a very nice person. And I think we made the point of uniting people, which is very important, and exchanging experience from low-budget countries with the high-budget countries. And we take the profit of getting those people all together. That's the most important thing.
Wonderful. And so LACES is a very new society, right? This is just 2 years old. You'll be the second president.
Yes, right? We started just before the pandemic. Okay. In a meeting in December 2019 over in Uruguay, we had the idea. Victor had the idea, spoke with me, and we started that. But then came the pandemic, and nowadays that was the first meeting that we did for LACES. And I said to Victor, well, you'll be staying president until the next STS-EX meeting, which is going to be in Buenos Aires, 5th to 7th of December of next year. But we signed the bylaws last year in Montevideo. So that's when it started being LACES as an official association.
Well, it's really exciting because there previously wasn't a continental representation for South America. So what are some of the goals, do you think, of LACES?
Well, I think what Victor is trying to do is putting the Latin American countries into perspective, so everyone knows that there are countries after Europe and North America and the Asian Society. So there's, let's say, 5 regional societies over the world: the Asian Society, the European, the 2 American ones, and the World Society, which is struggling to become a perspective in scientific point of view. But I think what we want to do is unite people over in Latin America, so we could construct a database that we know the results are different from Europe and the problems are different, and then to try basically on the point of education also, so that the residents can go over from one country to the other and see centers, and that will be a nice thing too. So it has been tested before, it has been tried before to do a Latin American association. It died. I think the ruler of this and the mind on top of this is Victor Dayan, who started it. And we have to continue the motion.
Sure.
I think most of the societies, the regional societies, are backing up the LACES, so that will be nice. And also STS STS and the European Society are behind it.
And they have had more of a collaborative interaction, I think, with Latin America, haven't they, in the last few years?
Yes, they started doing that because they're doing. This is the Cartagena last year was the fourth meeting of STS together with the European Association,
Sure.
and they're trying to bring the standards. On the point is raising the bar of the Latin American surgery over to come over, and they even given up some grants for people from Latin America to go to America and to go to this. I think there's an important person behind that. One is Rafa Sadaba. He's very interested in that, and the other one is Joe Bavari from the STS,
Sure.
which are people that are bringing together the LACES. Even in Cartagena, we had a meeting, and basically they decided that LACES would be part of it until we grow up, and when we become 20 years of age, we go independent.
You leave the nest. So I heard in a recent session today that they're talking about even something like a LATAM score, like the Euro score, some kind of system that would, like you said, sort of stratify risk with the pathology that you see in many of the Latin American countries that might be different from Europe and North America.
Yeah, there's already one done by an Argentinian person, but that's Argentinian only. We wanted to put it over for the Latin American people, everyone, because I don't know in Europe, but over there it's very regionalistic. Sure. If they do it something from one country, some of the others won't adopt it, and it's a difficulty because I think most of it is ego things. But doing the LACES, it will be something different, and we'll try to unite everyone.
Sure.
There's people still coming on board.
Sure, and a Continental Database would be really interesting as well.
Sure.
Do you think that will be connected in some way to STS, or is it something that you think will be?
Well, I think that we're trying to do a database. We're starting, say by cabbage, and then growing up.
Sure.
The problem is that most people, we even have one or two in Brazil. Most people, if they are not obliged to do it, they'll forget some of the parts. CTSNet works because you only get paid if you get the data inside, and you can't do that in all countries.
Sure.
So it has to be something that will not be 100%, but it will be a start.
Sure.
Whenever people say, look, I think the database is good, they get on board.
Sure, okay. And maybe to shift a little from your professional president role is as dean, so dean of the medical school in the past. What's that like as a cardiothoracic surgeon?
I'm still the dean of the medical school. It's a private institution, and I've just retired from being on the state university.
Okay.
And I think I got that virus from my father, who's a professor at the university. And it's very nice to be in contact with the young people, because you get spiked by them to learn some new things, and you still get with this new generation, which is very different from what we were. I'm from a generation of a workaholic where I didn't have any hours for residence. It started at 6 o'clock in the morning. It went up to 3 o'clock in the next morning. There was no problem with that. But these ones, they want quality of life.
Sure.
And most of them, they don't want to go over to see what's in the middle. They just want to go to the conclusion part. So you have to understand them. You have to join them. But it's very rewarding to speak with those people. I gave up giving lessons. We have over in Brazil what we call leagues of academic students, okay, in cardiology, englobing cardiac surgery also. And we've started by the National Society of Cardiac Surgery, a league that's nationwide, and that's very good. Really, it's most of them they are students that will be going over to cardiology, cardiac surgery, and they discuss a whole lot of things, and you learn from them. I think it's an important part. I'll be giving up cardiac surgery before giving up the education part.
Well, have you noticed appreciably any change in the interest in cardiothoracic surgery because you're, a role model for them?
Well, one of the things that I've seen is that for the last years, let's say the last 10 years, the amount of women that go over to the medical school is much higher than the men. You probably have in our faculty and in most of the Brazilian ones, 60 to 70% of women.
Wow.
And the rest is men. That's one of the points. But I think there's a stereotype of characterizing cardiac surgery as a non-woman professional. Sure. And I'm very much against that, especially because women, they are much more, I think in small details, they're much better than the men on that. I can't say that.
I won't argue with you.
But, and basically, there are some people that starting doing cardiac surgery, some women that are doing cardiac surgery, but still in below 5%. And that's bad, especially because in a few years, if they continue to have a whole lot of students, female students, and none of them go to cardiac surgery will be going down.
Right, sure.
That's one of the problems.
That's an interesting point. Hopefully these connections between these global connections will give more opportunities for role models in different places in the world, right?
Well, I hope so. It's interesting because when I was younger and was doing residence, we had some role models that were genius, really, in cardiac surgery. I trained with Yaroslav Stark and Mark Deleval at Great Ormond Street, and after that with Mr. Ross and Jakub over at the Heart, National Heart. And you looked at them as being people that you wanted to do something. Sure. Nowadays, you have a whole lot of people that are successful, but there's fewer role models for everyone. Sure. So you have, well, you went over to the Iguazu Falls for the meeting, and there's a whole lot of students that said, look, I want to be like Emily. I want to follow the Emily, because when you speak, you translate emotion for them. That's what I want to learn, basically.
Thank you. That's a nice compliment. So if there's anything you could pass on to young trainees in cardiothoracic surgery in Latin America today, what would your message be to them?
Do whatever you want to do, but do it right. It's basically that. And pursue your dreams, and never give up because someone says you can't do it. Be resilient to do it, and you're going to be married with that for the whole of your life. So you have to really like it, because it's not because you wake up at 3 o'clock in the morning to do a dissection or anything like that, but it's because you have to do it right. So I think that's the most important thing really is you have your graduating students, you have your residents, and don't mess about being male or female. You can, both of them can do it, and it will be nice. And it's not just because you get pregnant or something like that you can't do cardiac surgery. Right. You're more capable of doing it because you understand everything much more than we do.
Well, that's a great message, and I think you're an excellent role model for young trainees. So thanks for speaking with us. I think we'll try to follow up with you in several months and see how your new presidency is going when it starts.
Okay, thank you very much for having me here. It's been very nice.